In the medical industry, there are many disciplines. They all share the goal of improving, saving, or changing lives. Join us as we meet the people, discover the technology, and explore the organizations of this vital industry. Maintaining health and well-being is often simply a matter of making sound, informed choices. Here's an example of a healthy practice that could make a difference.
According to the Centers for Disease Control, drug abuse in the U.S. has more than tripled since 1990. Surprisingly, prescription drugs are the most commonly abused and the leading cause of drug overdose. Research shows that more than a third of people over the age of 12 who used drugs for the first time in 2009 started with prescription drugs.
Prescription drug abuse is increasing because of the misperceptions about their safety. Since these medications are prescribed by doctors, many assume that they're safe to take under any circumstances. But under the right circumstances, they can be deadly. Over the past decade, the age-adjusted drug poisoning death rate nearly doubled, from 6.2 in 2000 to 12.3 per 100,000 in 2010.
Since 2009, more people have died from drug poisoning than motor vehicle accidents.
The CDC has found that 100 people die every day from prescription drug abuse. The CDC also reports that for every death, there are 10 treatment admissions for abuse, 32 emergency department visits for either misuse or abuse, 130 people who are abuse or dependent, and 825 non-medical users.
Aeon Clinical provides testing services that better monitor prescription drug use. The company's services are provided at no cost to physicians, including testing for over 70 drug metabolites through urine drug screening and 50 drugs through pharmacogenomics, or PGX.
Aeon Clinical Laboratories was founded in 2011 with the goal of providing physicians a complete picture of their patients' drug usage. It is important for physicians to understand the significance of testing every patient. By holding patients accountable for taking their medicine and keeping track of them, physicians not only provide the best and most personalized care possible, but they also help alleviate the deaths and problems associated with drugs.
Aeon's urinalysis drug screening helps keep physician offices and treatment facilities compliant and ensures that patients are following their prescribed regimen.
By using our toxicology services, physicians know if patients are taking their drugs and exactly how much. This helps to limit the availability of medication for addiction and overdose. Aeon's toxicology services monitors usage to make sure that they are taking their therapies as prescribed.
The FDA recently added a box warning label for some drugs, indicating they can be toxic to certain patients, even if prescribed by a doctor.
Toxicology testing can be very useful for preventing potentially harmful drug-drug interactions. For example, we had a recent case in which a patient tested positive for 2 barbiturate drugs, the combination of which could lead to death. The physician in this case discontinued use of one of the drugs, preventing harmful effects. It is cases like this that exemplify the importance of Aeon's clinical toxicology testing services.
For oral drug testing, Aeon's PGX labs test a patient's DNA to determine their individual metabolic rate for defined medications. The testing allows for targeted therapy based on a particular patient's genetic makeup. Using these services, physicians know how patients will react to certain drugs and dosage information, helping reduce accidental overdoses and drug poisoning.
Combined, our toxicology and pharmacogenomic services are leading the way to personalized medicine. What we pride ourselves on most is our client focus and customizability. It is our goal to equip the physicians with everything they need to prescribe with confidence.
In addition to urine and oral drug testing, Aeon is leading the way in research and investigating the role drugs play in women during pregnancy.
A large percentage of women take drugs during pregnancy. According to research conducted at Aeon Clinical Labs, we found as many as 30% of pregnant women at certain clinics test positive for drugs not prescribed by their physician. Although the OBGYN specialty has not widely utilized toxicology testing in the past, they should certainly consider adding this valuable tool to their standard of care.
It is crucial now more than ever for physicians to use services like those provided by Aeon Clinical Laboratories. This helps fight the epidemic of drug abuse. It is Aeon's goal to advocate the importance of testing and help physicians stay compliant and aware of their individual clients' needs. Aeon provides the tools necessary for every physician to personalize medical treatment, improve clinical outcomes, and ensure patient safety.